Ladies and gentlemen, thank you very much for this opportunity to introduce you the results of our study. My name is Kirill Lobastov and I'm from Moscow, and I have nothing to disclose according to this presentation. For today, the anticoagulation is essential for the treatment of superficial vein thrombosis, and the recent guidelines of the European Society for Vascular Surgery suggested the main duration of anticoagulation of 45 days in all patients with the extended SVT, and in those who are at high risk of further VTE, the anticoagulation could be extended for 3 months. However, there is a lack of evidence how the duration of anticoagulation influences the risk of the VTE. And to cover this gap, we decided to make the meta-analysis and to answer this question: how does the duration of anticoagulation therapy impact the risk of venous thromboembolism in patients with superficial vein thrombosis of lower limbs within the mid-term follow-up? So we designed the protocol of this meta-analysis in July 2021, and we included the trials which enrolled the patients with a superficial vein thrombosis without concomitant DVT and PE, who were treated with a different anticoagulation in different doses and duration, and that were followed the patient at least 45 days and assessed the further venous thromboembolism with the appropriate confirmation. And the primary outcome of our analysis was the combination of symptomatic or asymptomatic superficial vein thrombosis progression or recurrence, development of new DVT and PE, and the secondary outcome included the components of the primary outcome. And we divided all the patient according to the duration of anticoagulation into 5 groups. Those who didn't receive any anticoagulation, it was the placebo group from the randomized clinical trials, and those who didn't receive anticoagulation in the cohort trials. Those who received anticoagulation less than for 14 days, who received anticoagulation from 15 days to 30 days, those who received anticoagulation from 31 days to 45 days, and more than 45 days. And our hypothesis was that the duration of anticoagulation should correlate with the risk of the further development of venous thromboembolism. Due to the different trials included the different duration of follow-up, we converted the incidence of venous thromboembolism to the rates per patient months, and these event rates were pooled using a pooled proportion meta-analysis with a random effect model, and then we translated the patient months to the patient years to make it more comfortable for the analysis. So here you can find out such a strategy, and we search the PubMed and Cochrane library for the relevant papers, and we find 15 relevant studies, and also 6 studies were found through the searching of the reference lists of the most important papers and from the personal collection of the authors. And that's why we combined the 21 studies. It was 10 randomized clinical trials that are well known. It is Callista, Stanax, Teflux, Surprise trial, and 11 prospective or retrospective cohort trials. As you can see, these trials combine patients who received different anticoagulation, unfractionated heparin, low molecular heparin, vitamin K antagonists, diuretic oral anticoagulants, and fondaparinux, and the patients were followed for different time from 74 days to 1026 days. Here you can find the pooled data of all trials for the primary outcome of all venous thromboembolism, and here you can find the very high heterogeneity, and the pooled VT rate was 2.3 per 100 patient months. And here you can find the primary outcome according to the subgroups of the patients. Though the highest event rate of VTE was found in those who received a short-term anticoagulation of 14 days and less. It was 3.8 per 100 patient months. It was followed by those who did not receive anticoagulation at all. It was 2.8 per 100 patient months, and the lowest incidence of the VT rates were found in those who received the extended anticoagulation, more than 15 days and more than 31 days. And here we present you the results which were transferred into the rate per 100 patient years. As you can find, the overall VT event rate was the highest in those who received the short-term anticoagulation. It was even higher in comparison with those who did not receive anticoagulation at all, and this increase was related predominantly by the high rates of the DVT and pulmonary embolism, but however, the progression and recurrence of superficial vein thrombosis was reduced in comparison to those who did not receive anticoagulation at all. And the minimal event rates was found in those who received the prolonged anticoagulation more than 31 days. It was the reduction in the incidence of the all venous thromboembolism, the incidence of the superficial vein thrombosis progression, recurrence, incidence of DVT and PE. And of course, the large impact to these results was put by the Fondaparinux Callisto trial, and we decided to make the separate analysis of those trials which used Fondaparinux. And of course, you can see that there is the lowest risk of the VTE development in such a subgroup of patients. But however, when we excluded the Fondaparinux, the studies, the extended duration of anticoagulation, however, still was associated with a decreased number of the LVT events, SVT progression and recurrence, DVT and PE in comparison to those who did not receive anticoagulation at all. So also we looked through the risk factors which were reported in the personal trials, and we found that the male sex, cancer, personal history of venous thromboembolism, and thrombosis of non-varicose veins were the most common risk factors which may be clinically relevant to find out patients who will benefit from the extended anticoagulation. So, ladies and gentlemen, we were able to conclude that prolonged systemic anticoagulation is associated with decreasing the VTE rates in patients with lower limb superficial vein thrombosis, and the optimal duration of anticoagulations need to be established in the future trials. Thank you very much for your attention.